Imagine that you're in a hospital. You've been hospitalized for a terminal disease that makes your bones feel like glass, and every waking moment you are in pain. No amount of medication will help you ease the pain, and you are confined to your hospital bed until you die. Does this sound like one of your worst possible nightmares? This nightmare is actually a reality to many in our healthcare system at this very moment. Okay, and is there a way to bring an end to this nightmare? Euthanasia is defined as the act or practice of killing or permitting the death of hopelessly sick or injured individuals in a relatively painless way for reasons of mercy as stated by the dictionary website Merriam-Webster. Euthanasia should be legalized. The word itself originates from Greek and it translates out to an easy or happy death. The legalization of euthanasia would benefit the healthcare system as of right now because of three main points. It gives patients better control over their treatments. Euthanasia is actually economically beneficial, and euthanasia provides a quick, painless way to die. My first point is euthanasia gives patients better control over their treatments. It gives them more options to choose from other than living through the pain and suffering many long hours of painful treatment. The promise that the medical community makes towards helping individuals become well through any treatment necessary is common knowledge. Doctors will do anything to help you get better, but sometimes patients don't want that. So, therefore, euthanasia should be offered as an alternative treatment along with the medication and other treatments such as for cancer patients like chemotherapy. The more options that are presented, the more control that someone has over their lives. Over their lives. Okay, and we all want a painful death. No one wants to die suffering slowly under immense pain and agony. Elderly people especially would like control over their lives when they pass away. That is quoted by Warren in his letter from an elderly man who was about to die. Patients seek relief from symptoms such as unremitting severe pain, breathing difficulties such as choking and suffocation, and nausea and vomiting. I don't think anyone wants to go through that while they die, so euthanasia will easily solve that problem and bring a quick, painless way to die. My second point is that euthanasia is economically more beneficial. It costs more money to keep a person living, since they're always hooked up to machines and demanding medication, and they take away the doctor's and nurses' time from treating patients that could actually survive. As quoted by Lindenberg, 10% of our lifetime medical expenses are used within the last few years of our lives, and 28% of Medicare is used for treating illnesses for seniors. This cost could be dramatically reduced if we allow people the choice for euthanasia. My third point goes along with my second point. Euthanasia provides a quick, painless way to die. This statistic will illustrate why my second point is more economically beneficial. Medical illness was a factor in half of the suicides of people ages 50 and older. 70% of those were 7-year-olds and older. Increased life expectancy, chronic illnesses, and technological advances and expanded treatment options have all complicated the process of dying. This was published by McElprin, and this shows that half of the suicides are people who are 50-year-olds and over. So if they were given the option of euthanasia, they it would cut down the costs for medical bills and such to their families. My last point, my last statistic is by Ezekiel Emanuel, and it was published in the Lancet, which is a medical journal, and he states that about 2/3 of oncology patients and the public found euthanasia and physician-assisted suicide acceptable for patients with re-emitting pain. More than a quarter of oncology patients had seriously thought of euthanasia of physician-assisted suicides, and nearly 12% seriously discussed these interventions with physicians and others. With this in mind, my conclusion is that the benefits of euthanasia are that it could benefit the healthcare system in terms of money, and it would allow patients more control over their treatments, and it would give us the benefit of passing away quietly with no pain.
All right, at the beginning you have it as a policy claim, and then you follow up with a claim of fact, so it's a little confusing what you're actually advocating. You want to be careful about that. I thought there was a good layout of the secondary points and that you did a good job signposting them in the body of the speech, so structurally things are pretty good. Your development on the first point needs to demonstrate that there is a lack of treatment for many of these patients and that in fact they suffer. There's a presupposition that they suffer and are not able to relieve themselves of the pain. You start off with this visualization. Imagine yourself being in this situation where you don't have the ability to relieve the pain. And okay, that's one thing to imagine it. Where's the demonstration that anybody goes through such a situation or circumstance? There's nobody doubts that people suffer, but the question is there treatment for that suffering? The vast majority of people, for instance, even cancer patients who are going through very painful process, you give them enough morphine, they don't feel the pain. So I'm not sure why euthanasia is the required answer. And then the other issue is, if suicide does the same thing, why do we need something other than suicide as an option? Doesn't that minimize the need for euthanasia? I think that you create a problem for your argument by advocating the financial issue, because that's going to be a causality argument on another line of reasoning. For a policy argument, it would be a very important thing. For a claim of fact, I think it's a little bit problematic, but by introducing the cost issue, I think that you have invited this as a response from the opposing side. You have a tendency to cite the evidence after you've presented the information. You want to cite it beforehand. I thought that there was some good data about how patients feel a need for having this option, and that probably would have made more sense combined in that first point, and then it would have developed a little bit more along the lines that we were talking about. All right, thank you.